Many of you have questions about nerve damage that may not be related to diabetes, smoking, autoimmune issues, chemotherapies, radiation therapies, but it may be related to a trauma, a surgery, or some sort of injury. And so I want to go through this with you. When you look at the peripheral nerves that come out of the lumbar spine, this is how you can get neuropathy from compression of these nerves that come out of the back. This is why disc degeneration, bulging herniated discs are such a big issue, and we treat those here at the office. But there's only so many places that if you're having foot pain, and a lot of the times if it's bilateral, it either has to be a metabolic issue like diabetes, chemotherapies, radiation therapies, alcohol, smoking, or it has to be more central in the spine here because it has to affect both sides. If you have a unilateral neuropathy, most of the time these are trauma-induced, surgery-induced, or they can be coming from the back as well, because there's only so many entrapment points. It can happen here at the ankle, usually it can happen at the knee, it can happen at the hip, and it can happen at the low back. In certain cases, of course, this is where your doctor has to do a really good history. It can be coming from all the way up from the neck, but this is most of the time you're going to see it in the arm. So if it's happening in the arm, it's either happening in the wrist, the elbow, the shoulder, or the neck. There's only a few other places that it could happen. Of course, you can have a trauma to the nerve here or here, which can cause it, but most of the time it's going to happen at these joints because that's where the nerves are more susceptible. And so by understanding this, you can help really evaluate, what the cause is and how to treat it. And a lot of times these traumas or structural induced neuropathies can be harder, but they are doable, and most of the time you can recover to a certain degree. Not going to say that you can cure it, but you can recover to a certain degree the proper nerve function, restoring the blood flow, and getting rid of the inflammation in the area. I hope this video was helpful. Like and share this if you found it helpful, and there's free resources in my profile down below, and so if you have any questions, just comment. See you all soon. Bye.